We have all been adapting to the unprecedented challenges posed by COVID-19, which forced us to postpone non-urgent procedures and visits. But throughout this crisis, we have continued to serve patients who required emergency eye care. This experience has prepared us for the next steps as we open our doors to our community and resume comprehensive and elective eye services and surgeries. Concern about the pandemic has meant that many people may have overlooked seemingly minor or inconsequential eye problems, or simply delayed seeking medical care for fear of visiting a hospital or doctor's office. However, your vision is too important to put on hold. As you evaluate the risks and benefits of resuming your health visits, please be assured that the health, safety, and well-being of our patients continues to be our top priority, and that we are ready to welcome you back to a safe facility. Thank you for entrusting us with your care.
Let's step through the measures we have implemented before, during, and after your visit to ensure your safety. A few days prior to your appointment, a member of our staff will contact you to inquire if you have any COVID-19 symptoms and alert you to any changes in our check-in procedures. If you are experiencing any symptoms of COVID, we ask that you request to reschedule your visit or request a video visit. In addition, to help reduce your wait time and contact with others in our facilities, we will email registration forms to patients to complete in advance. This will expedite the check-in process on the day of your visit. When you arrive at New York Eye and Ear, you will experience layers of safeguards designed for your protection. Please arrive about 20 minutes prior to your appointment to account for these measures. At the entrance, all visitors and staff must sanitize their hands. Gloves worn from outside the building can transmit coronavirus, and we will ask that they be removed and discarded. After you sanitize your hands, a fresh pair of gloves will be provided if you need them. Then a nurse will take your temperature and ask you a few screening questions for COVID-19 symptoms. Patients showing symptoms may be referred for a telemedicine visit or rescheduled for after they recover. However, we know that sometimes healthcare can't wait. That is why patients presenting with ocular emergencies who have COVID symptoms may be seen in an isolation room or be referred to an emergency room for a complete workup of their systemic and eye problems. If you are visiting a satellite office, a similar procedure will be employed. Throughout your visit, you will notice that all patients, visitors, and staff are required to wear face coverings. This is for your protection. When you arrive, you may be offered a mask to wear if you are not wearing a suitable face covering. All visitors then stop at the security desk and obtain a visitor badge that must be worn while you are on campus. Once you have your visitor badge and have completed the screening process, our staff will direct you to your physician's office. As you walk throughout the campus, you will see signage and decals acting as reminders for you to practice social distancing. We are eliminating chairs in our waiting areas to allow 6 feet of space between patients, reducing the number of patients in waiting areas, and scheduling more time between appointments. Signs inside all elevators remind patients and staff to stay an arm's distance between each other and not overcrowd the elevators. Upon arriving at New York Eye and Ear, you can feel confident that you are entering a clean facility where all areas are continually disinfected. Our environmental services team rigorously cleans and sanitizes all areas of the hospital 24/7, including waiting rooms, patient rooms, and high-touch surfaces. All patient exam rooms will be thoroughly disinfected between patients. You will notice signs denoting exam rooms that have been cleaned and sanitized. We are following the New York State guidelines on visitor restrictions. Please visit the Mount Sinai Safety Hub website for the most up-to-date information.
Having surgery during the COVID era can be unsettling. Rest assured, we're taking every precaution and have many safeguards in place to make sure your surgery will be performed in a safe and sterile environment. Your physician will discuss your procedure, what to expect, and how to prepare. In addition, your surgeon will address any specific questions you may have regarding your care. It is important that patients take additional precautions whenever possible in the 14 days prior to and after your procedure. Simple measures include wearing a face mask, frequent hand washing, limited contact with others to help minimize the risk of being exposed to the coronavirus. Patients must complete pre-surgical testing that includes being tested for COVID-19. Patients will also be screened for COVID-19 symptoms upon arrival on the day of the procedure. We'll also ask you to call your physician should you develop symptoms of COVID-19. Symptoms to watch out for include cough, fever, shortness of breath, body aches, chills, fatigue, or loss of taste or smell. In some cases, your surgery may be postponed until it is safer for you to undergo surgery. Sometimes patients that test positive for COVID-19 require emergent eye care or even surgery. In these cases, we have made special preparations for COVID-19 patients that include strict protocols to isolate COVID-19 positive patients while on premises. This allows us to provide necessary eye care in a safe environment. At New York Eye and Ear, all staff adhere to the same high standards of safety throughout the facility. All patients and staff must wear a mask and relevant PPE. All surfaces in the OR are thoroughly disinfected between each procedure. We hope you're reassured that we're taking every possible precaution to keep you safe.
Our ophthalmologists understand this is a challenging time for many patients, yet it is important to not put your health care on hold. If you are not comfortable visiting your physician, we would like to make you aware of our telemedicine option. Patients can schedule a telemedicine appointment with their physician to discuss their condition without leaving their home. The physician will contact you at the scheduled time for a phone or video encounter. Please note, certain eye conditions may require an in-person physical exam and/or visualization of the structures of the eye. As you can see, the new normal is anything but business as usual here at New York Eye and Ear. We are sparing no effort to keep you safe and provide quality care, whether you prefer a telemedicine or in-person visit.